Good morning, ladies and gentlemen. It's a great honor for me to introduce our second paper named Nomogram to predict survival of patients with advanced and metastatic pancreatic cancer. Our research aimed to identify the effective survival predictive factors and to develop a comprehensive clinical model to predict survival probability in patients with pancreatic cancer. We enrolled 323 patients with advanced and metastatic pancreatic cancer that were treated at our department from 2010 to 2018. Baseline nomogram was constructed using baseline factors of 323 patients. Among all these patients, 233 patients whose tumor showed initial responses to first-line chemotherapy were enrolled in the chemotherapy response-based model. Baseline nomogram was constructed using baseline variables, and chemotherapy response-based model constructed using factors involved in the initial response to chemotherapy and changes in the expression levels of tumor markers after 2 cycles of chemotherapy. Table 1 shows the result of univariate analysis. Table 2 shows the result of multivariate analysis. According to the result of multivariate analysis, KPIs gender, baseline CA199 and LDH were used in the baseline model. KPIs gender, baseline CA199 initial response to chemotherapy and second-line chemotherapy were included in the chemotherapy response-based model. Calibration curves indicated good agreement between prediction and observation in the two models. Predictive accuracy of the models was compared using the ROC curves. The AUC of the combined model was significantly larger than those of other individual predictors. We also used DCA to evaluate the net benefit and clinical application value of our models. In the two nomogram models, the combined predictive models showed better clinical unity than the predictive value of any single variables. In conclusion, this nomogram was constructed to predict the survival probability of patients that had gone first-line chemotherapy for the treatment of advanced and metastatic pancreatic cancer, and the chemotherapy response-based model performed better than the baseline model. Okay, that's all. Thanks for your attention.